Hello, we are Summer Hayes and Kelly Braun, D&P students at the College of St. Scholastica. Our doctoral project is titled Understanding Barriers to Colorectal Cancer Screening at an FQHC, Insights from Patient Surveys. Our agency site is Lake Superior Community Health Center. Since 1991, an estimated 3.8 million cancer-related deaths have been prevented, a 33% overall reduction, primarily attributable to an increased focus on prevention strategies, like cancer screenings. Notably, while cancer screening significantly reduces mortality rates, numerous individuals encounter barriers that impede adherence to recommended screening guidelines. Understanding and addressing these barriers are essential in fortifying efforts to identify cancer at its earliest stages. Current literature delineates several obstacles impeding patients' access to screening. However, delving deeper into patient-reported barriers is crucial to comprehensively grasp the multifaceted challenges hindering optimal screening rates.
Lake Superior Community Health Center, a federally qualified health center serving many uninsured, underinsured, and medically vulnerable patients, reports a chronically low rate of patients completing their recommended colorectal cancer screenings, with figures notably lower than the Wisconsin, Minnesota, and national averages, despite implementing several evidence based interventions known to combat barriers. This is alarming as the World Health Organization ranks colorectal cancer as the third most frequently diagnosed cancer and the second leading cause of cancer related deaths in the U.S. Colorectal cancer screening has been demonstrated to be one of the most effective interventions in preventing colorectal cancer. The aim of this quality improvement project is to identify and better understand the barriers to colorectal cancer screening as perceived by the patients at the agency. This will provide the agency with a better understanding of how to tailor future intervention efforts to improve colorectal cancer screening at Lake Superior Community Health Center.
In an attempt to address known barriers, the literature describes the effectiveness of multiple interventions in boosting colorectal cancer screening rates, particularly when deployed together in what is known as multi-component interventions. However, our clinical agency has and is currently implementing numerous evidence-based interventions, such as patient reminders, direct-to-patient fit tests with return postage, and transportation support. Despite this, the persistent gap in screening rates remains. This highlights the importance of hearing directly from the patient population through the use of a survey at Lake Superior Community Health Center, as supported by the literature as a method to improve quality of care. Furthermore, the literature advocates for tailoring the survey's literacy level to a 6th to 7th grade level to ensure accessibility and comprehension among patients. Employing a mixed methods approach, combining both quantitative and qualitative data, can further deepen our understanding of barriers and facilitators to colorectal cancer screening uptake within our community. According to the agency's population health specialist, the patients have never been surveyed to assess self-identified barriers to completing colorectal cancer screening. Considering the significant impact of social determinants of health, such as social isolation, immigration status, poverty, and education levels, on colorectal cancer diagnosis and survival rates, it is crucial for the agency to implement effective interventions to increase screening rates. These interventions should be tailored to enhance colorectal cancer screening within their patient demographic, taking into account the social realities in which these patients reside.
Drawing from the literature supporting surveys as effective tools for understanding patient barriers, a survey will be administered to age appropriate patients who are not up to date with their colorectal cancer screening, as determined by the U.S. Preventative Task Force and American Cancer Society recommendations. The survey will adopt a comprehensive mixed methods approach, integrating both qualitative and quantitative question formats, including Likert scale ratings and open ended inquiries. This approach encourages participants to provide detailed insights into their unique barriers, ensuring a comprehensive understanding of their perspectives. Moreover, to maximize accessibility, the survey will be designed at a 6th grade literacy level. After administering the survey, the results will be analyzed using descriptive statistics, qualitative analysis, and bivariate analysis using t-tests, which will then be provided to change leaders at the agency.
Following IRB approval, the project will start and follow a predetermined implementation plan. First, a Zoom session will take place to educate all agency stakeholders on the plan. Next, the agency will print the survey and get all accompanying materials ready. Also, the population health specialist will flag eligible patients for the survey. When those flagged patients come to the clinic for an already scheduled appointment, they will be educated about the survey and asked to participate by the front desk staff. The survey period will start and go on for 8 weeks. Completed surveys will be securely stored in a locked cabinet. Weekly, the QI director will scan and send us the returned surveys. Upon project completion, all data will be assessed and presented to the clinic. Finally, after data analysis, the surveys will be shredded and any emails containing scanned surveys will be deleted. Many thanks, and we look forward to completing this quality improvement project.